A Chinese study produced similar encouraging results. This study was conducted at the Department of Urology at Peking University People's Hospital in Beijing, China. The group consisted of 160 men over age 50 who had low testosterone levels and had shown symptoms of low T, such as fatigue, sadness/grumpiness, physical decline, losing height, fewer erections, and deteriorating job performance. During the 6-month study, the men received either a placebo or oral testosterone undecanoate, 120 to 160 milligrams daily, depending on their baseline testosterone levels. Initially, many of the men were stressed, experiencing erectile dysfunction, and reduced quality of life. In short, the perfect definition of clinical depression. However, after completing the treatment regimen, the men receiving TRT experienced vast improvements in all areas measured. The subjects in the placebo group received no noticeable improvements in their depression. Other studies have failed to unequivocally establish the low T/depression link, so the research continues. Mental health professionals are increasingly looking into the low testosterone link to depression to ensure that they do not overlook a possible treatment. This is especially true for patients who have not responded positively to antidepressants. Low testosterone symptoms often are a cause of psychological problems such as After looking at this list, it is obvious why psychiatrists are looking closely at testosterone replacement therapy. There is no question about it. For some people, antidepressants are a lifesaver. Common selective serotonin reuptake inhibitors, SSRIs, like Prozac and Zoloft, and norepinephrine dopamine reuptake inhibitors, NDRIs, like Wellbutrin, have worked wonders and brought countless people back from the abyss of severe depression. But these drugs don't work for everyone. Some people have spent years and even decades on the prescriptions, as mentioned earlier, as well as Xanax and Ativan for anti-anxiety, Adderall for attention deficit hyperactivity disorder, ADHD, and other antidepressants like Remeron, all to no avail and no relief. Worse, for some patients, these drugs cause horrendous side effects: nervousness, anxiety, dizziness, dry mouth, headache, and blurred vision. For these unfortunate folks, the severity of their depression is difficult for regular people to understand. Many people caught in the death grip of depression have difficulty with basic life functions such as sleeping, working, or eating. In fact, some depression sufferers are challenged to even get out of bed in the morning. Their existence is feeling like they have waded into quicksand. They're stuck and sinking fast. So if standard treatments like the previously mentioned drugs do not provide relief, testosterone may be their last hope. Quote, "We need to more completely understand the significance of the consequences of low testosterone, and to what extent testosterone therapy is effective in mitigating those consequences," end quote, said Dr. Christian Pike, a professor at USC's Leonard Davis School of Gerontology. Dr. Pike feels that more research is required before testosterone replacement therapy, or TRT, becomes a viable and safe treatment option for depression. But he added that, quote, "There is evidence from research in my lab and others suggesting that low testosterone increases the risks for Alzheimer's disease, metabolic syndrome, type 2 diabetes, and several other age-related conditions," end quote. While not all studies on the link between low testosterone and depression agree, we continue to see more and more compelling evidence that points to low T as a culprit in the crippling, cruel affliction called depression. Increasing numbers of men in their 50s and 60s are suffering from both low testosterone and depression, and are not passively accepting their gruesome fate. They are not willing to sit back and do nothing while their quality of life dwindles and falls off the cliff. No, they are fighting back, tooth and nail. They are increasingly becoming aware of how testosterone fits into the depression equation. And they are taking action, massive action. And you can join them. If you are experiencing extended periods of depression that exceed the usual ups and downs of everyday life, you owe it to yourself and the people who care about you to do something about it. And that's where our clinic is worth its weight in gold. We will run the lab tests, do the assessments, and discuss your treatment options in an easy-to-understand manner. Our testosterone replacement therapy regimen is both safe and affordable. We will guide you every step of the way to let the light shine and pierce the dark veil of depression. Don't waste another day of your life in the death clutch of this monster called depression. Get your life back. This is not something you want to do on your own. We have the experience, equipment, and the techniques to kick depression out of your life, once and for all. If you found this video informative, please press the like button and subscribe to the channel. To learn more about health and wellness regarding testosterone replacement therapy, please click the link below in the description.